Hello, everyone, and thank you so much for joining us for this 100% Community Impact Live event. We do apologize for some of the early glitches with technology. I think it's actually kind of appropriate when you think about what we're here to talk about, which is about being prepared and being able to respond. And so we really appreciate you making the switch. And again, thank you so much for everyone being here. My name is Michelle Rathman, and I brought this group together because I have been passionate about stakeholder engagement for many years. For those of you who've worked with me or understand the work that I do with rural health organizations, you know that I believe the best way, the most important way for us to bring our community back to health is to engage community stakeholders. And by that, I mean not just the people who work in healthcare, but schools, faith-based organizations, local businesses. We all have a role to play. Now, when I was working on National Rural Health Day 2019, I had the privilege to meet Matt Probst. And if you have not seen the movie, The Providers documentary, I really encourage you to find a way to watch that film because it's so touching. Aside from needing a box of Kleenex, it really does tell the story of what's happening in rural and small communities across America. Great need with limited resources. And so the film, the documentary, The Providers really outlines that, and Matt and all of those who work with him really share how they are coming together to serve the needs of their under-resourced community. A few weeks ago, Matt sent me a message through Twitter and told me about something he was doing with his community, and it was about a book that he wrote called 100% Community. And as I learned more about what he was doing, I said, I really believe this is something that we need to share as wide and far as we possibly can. So within just a few weeks, we put this group together, actually with all of Matt's influence with his community collaborators. We put this group together, and we are here today to share with you information that we all hope will inspire you to make a difference in your community, and not just a small difference, but a big difference. So it is my absolute honor to introduce to you Matt Probst, and he will kick us off at this live learning session, and then from there introduce our panelists, and we'll get right into the heart of the matter, which is the 100% Community Initiative.
Thank you, Michelle. So yeah, absolutely. So all of us together, very nice to see so many folks on this learning event, and that's really what it all is about. It's about us learning together, working together, all of us for everyone. Can you hear me okay,
Yeah,
Michelle?
I can. If you all could mute yourselves, I'd appreciate it. I might mute everybody and then unmute you. Just 1 second.
Okay, is that better?
Yeah, that's better. Thanks, Matt.
Okay. Wow, what an interesting time we're living in. More than ever, it's really about all of us, hopefully across the country and definitely within our communities, weaving our efforts together, weaving our efforts together to respond to crisis, to be there when our communities need us most. And I know for all of you that are on the call, that's what you are, that's what you do, that's your passion, and that's why you're on this session. This is our language, is helping those in most need. And so for me, my work as Chief Quality Officer and Medical Director of El Centro Family Health is about underserved healthcare, being a federally qualified health center in rural and frontier America. But as Michelle and I spoke last on her Rural Matters podcast, it's really not about underserved, it's about under-resourced. Because we do a lot of serving. If we've learned in rural healthcare to make a little bit stretch a long way, to take care of everyone the best that we can with a little bit of resources. And so as Michelle gave a little bit of a timeline there, so yeah, some of you already know mine. So if you've seen the Providers documentary, you know a little bit about my story and my background and who I was growing up and who I am now. And I think, it's not my story, it's our story, the story of rural America and rural healthcare. And so with that, as Michelle said, we had National Rural Health Day. Hopefully a lot of you were able to see that event. I would say that 2019 we had a story. We had, if you will, a call to action, and that was the Providers documentary. And so many of us in our own communities, the story in the Providers documentary is just a story of rural health, and we can all relate. And not just rural health, I would say back to underserved health. That could be underserved in other parts of the world, that could be underserved in inner city, in any community. And so, with that, there was a call to action. And so that gave me the opportunity to travel the country and do a lot of speaking, and really bring awareness to the issue. I would say that, along with National Rural Health Day and other initiatives, lots of 2019 for Matt Probst, of the year for the country, and primary care provider of the year for the country, along with my colleagues from the film, Chris Ruge and Dr. Leslie Hayes, and National Rural Mental Health Provider of the Year for the country. The end of all of that is exactly what Michelle said. I mean, it ended with, enough calling to action. Like, we need a plan of action. Like, we need action. And so that's really what it was. Coming home after, traveling the country, which is was new to me as just a rural boy, just a country boy. Country comes to town in New York City and Washington, D.C. and a lot of places. There were no more resources here. There was no more resources here than when it began. There was, as I say in the film, there's so much beauty here, but there's so much pain in rural healthcare. And, coming home, the point of the film to me was, will it make a difference? Will it do some good? Will it bring us resources? And there really wasn't any more. And, I've been using a little bit like the hunting analogy to say there were a lot of trophies and awards and an award-winning film and a lot of plaques on the wall, like antlers on the wall, but no food on the table, no meat in the freezer to feed my community. And so a real feeling of emptiness for me personally. And then saying, well, what do I do with that? How do I help my home community? I've been talking about national rural health care, but what do we do here now? And so, it became a search looking for what are the opportunities to really bring something home and do more here. And so with so many need, but yet there's also opportunities. And by that time, Matt Probst had become a brand, if you will. And so many different folks were approaching me and saying, hey, would you sponsor this, or would you speak on behalf of this project or this initiative? And some of them very good. And I was approached by Doc and Dom, as we affectionately call them, Dr. Katherine Ortega Courtney and Dominic Cappello, the authors of 100% Community. And at first it sounded like just another one of those phone calls, here's this thing. But this was different. This was, about New Mexico, so it was, okay, that's home. And this was about youth. It was about childhood trauma. Okay, there's my passion, youth medicine. For those of you who've seen the film, that's my passion. And it sounded different. And so it was first, read this book, Anna Age 8, another a short read, but another call to action, if you will, very much in line with, the Providers documentary, with so many of the heartbreaking stories we know very well in our own communities and from across the country. And so that was a quick read, but did leave me hungry for more. And then, there's this other thing called 100% Community, and it's much more than that. It's a plan of action. And so read this book next. And so I had that opportunity to read on a trip to New York City with a lot of layovers and a lot of downtime in airplanes and hotel rooms because of prolonged flights. And so, I was able to read this very big, book, 548 pages, I believe, in one trip. And wow, it was just such an eye-opener. It was like, this is exactly what we need. This is it. This is the plan of action. And this is an evidence-driven plan of action. It's about working together, and it's about really doing the best you can with what you have, force multiplying efforts, and it's evidence-driven. And so it's a recipe. It's a recipe that, we don't have to reinvent. We're good at working together in rural America, but this takes that to a whole new level. So very excited, the answer was yes. I want to be involved in this 100% community initiative, and I want this at home, not only in my own state, and I was happy to see that it started here, but in my home county, in the county I reside. So.
Yeah, I appreciate that, Matt. Because I, as I said, with so many of the communities I work with, it might be childhood trauma, it might be meth, it might be. I think about an event we did with Pep Spice and bath salts and all of that. And what I had noticed is that people were trying to tackle a specific problem, but as it was occurring, and not having that foundation, right? You guys, those of you who are the roots of it. And so we, in healthcare, we have this really favorite thing, root cause analysis. And at the end of the day, we might fix it, but then something else is going to bubble to the surface, and then we have to reconvene. So, Matt, I would like for you, we have some great panelists here, and of course the authors of the book. So kind of tee up for everybody how you got started, and then introduce Dr. and Dom. And I would love for you both to share with us what how this all started, and what was the vision for even putting this together, and then we could talk a little bit more about the coalition and how we built that and all the work that you all are doing together. So Matt, go ahead and kind of give your introduction of our two authors here, and then they can tee up the book for us.
So yeah, healthcare is a relationship, as I say in the film as well. And, that relationship started with, a lot of text and phone calls. I think we might need to mute there again.
Yeah, Catherine, sorry. Catherine, would you mind? Yeah, thank you. Sorry. Just 1 second. Go ahead, Matt.
Okay, so building a relationship. So it's one thing to read a book, you get to know some authors that way, you get to know about them, but really building a relationship. And I happened to be on my way to New York City in this process, and got to have a relationship, if you will, with Dominic Cappello, and someone who knew New York City, and told me, if you get to go to one place, go have some banana pudding. And so I did that, and was able to meet my niece there for her birthday, and have it really is about that, establishing relationships. The root, the foundation, if you will, is establishing relationships. And so, that really started a great relationship. And then I come to find out from the community I was born and raised in Rio Arriba County, is his co-author. So yeah, Doc and Dom. And then here in my own community, my co-director, Sheriff Chris Lopez. So we do a lot of things together, including working with youth, fighting substance use disorder, many of the things that you just mentioned that all have the same roots, if you will. It was just a natural fit to not just co-coach, but to co-direct a movement together. And then education coming in with Dr. Kim Blea, our Dean of Students. And so we have a student health center at Highlands University, but it is very interwoven, my relationship with Kim. Family connections, patient connections, school connections, and so that's really it. And with that foundation of trust, we started a movement.
You certainly did. So, Dominic and Catherine, I'm very eager for everyone to kind of hear how you two found each other and how you came up with this concept of 100% community. And for those of you who did not have a chance to click on the link in the email that we sent it a couple of times. You can download and just have a PDF, or certainly we encourage you to, purchase the book as well, the hard copy. But why don't you two go ahead, and whoever would like to start, Dominic or Catherine, the floor is yours. You unmute yourself now.
Morning, everybody. Am I buzzy? Do I sound okay?
You're great. Thanks.
Awesome. So our journey, Dominic and I met working for the Child Welfare in the state of New Mexico. We were both in the Research Assessment and Data Bureau, which was in charge of basically looking at continuous quality improvement for the state. So we were tasked with looking at the data and making recommendations on how do we improve the system based on that. What we found, though, was that that was not necessarily how the department ran. So we were in a broken system. Anybody who's familiar with child welfare knows that that is one of the hardest systems to work in. It's always struggling. And we started a program working with county offices in the rural communities throughout New Mexico, basically trying to train their staff on how to make decisions based on data, how to use continuous quality improvement, the process of assessing, planning, acting, and evaluating. What we found was that in child welfare and in the state government in general, especially back then, maybe 5 years ago, most decisions were made, gut feelings, this might work, this sounds kind of good, let's try this. And we were really seeing an opportunity to make decisions based on data. There's a ton of data in child welfare. There's a ton of tangible evidence of how things can get better. But what we found was the system was not working, one, internally, but also the system was really based on making referrals to other providers. So parents would come in with needs, and then it was the job of child welfare to refer those parents out to get services. What nobody was doing was looking at, do those services exist? Are they any good? Are they making a difference? None of that was happening. And it kept coming back to this kind of root cause, and we did a lot of root cause analysis in child welfare of these basic needs of the parents, things like housing and food and medical care that weren't getting met. And so we, while we were there were several child fatalities, unfortunately. One in particular happened right before a legislative session in New Mexico. It was a horrible tragedy, and this kid was very involved in the child welfare system and had been returned to live with her mom and was killed by her mom when she was 8 years old. And we felt compelled to do something. We were seeing kids die, and we were feeling this is really a preventable thing. And we can do better as a state. We can build the system better. But what we found in response to that fatality was that, again, the decisions that were being made were really just based on people's gut feelings. There was a lot of top-down orders, kind of like changing processes, changing procedures that were just based on people's kind of feelings and what might help, and not based on the data. And being in the data unit, we were very frustrated by that, because we had data that showed, these are not only things that aren't going to help, but in some ways they might make it worse. So that is why we decided to write this book called Anna, Age 8. We felt like we had to do something, and we had the resources to do the research. We had the skills to communicate. So we felt this is our strength, let's do this. The book Anna, Age 8 outlined basically the problem with child welfare, which involved everybody, and the root cause of adverse childhood experiences, which is the trauma that everybody faces, that if you don't have the resources to kind of get connected, to get help and fix yourself, as we're told to do, you're going to struggle as a parent, and the cycle is going to continue. So what we found was the root cause of the problems in child welfare was also the same root cause of poor school performance, was also the same root cause of pretty much every bad thing that we're seeing in New Mexico, which is adverse childhood experiences and lack of access to resources. What we outlined in that book, Anna, Age 8, was some solutions for child welfare, but we also laid out these 10 vital services that we realized if everyone had access to these services, everyone would do a lot better. So we labeled those 5 surviving and 5 thriving, and very, very basic, because we know through research, through every kind of research, psychology, medical, all of those, if people don't have the very basics, food, housing, medical care, they're not going to get to that higher level of thriving. So you got to start with the survival, and then you get to thriving. What we outlined in Anna, Age 8 was really just that. Everybody needs access to these 10 things, figure out how to do it, communities, this is important, basically. Through our work promoting that book and talking about it, we met a legislator who was very interested. He actually gave the ACEs test to one of his AP psychology classes and found that the numbers were startling. They were more than 3 times as high as we expected them to be. So kids were reporting 4, 5, 6 adverse childhood experiences in his classroom. He got activated, decided he's going to start something. We need to address this root cause. People need access to these services. So we started the Anna, Age 8 Institute almost a year ago, July 1st, 2019.
Wow.
What we realized then was that Dom and I had a plan, and we kind of knew how this thing would look, but from January to June, when the Institute started, we kind of said, we need a map, we need a guide for this. So that's how 100% Community, the book, started. We realized we need to get all the stuff that's in our head onto the page so that people have a roadmap of how to navigate this and how to do this. And it was based on our experience training child welfare. It was based on our experience working in state government, as well as foundations and other nonprofits, and kind of just the challenges that people run into. But we really learned through our work is the key ingredient is really the community, and activating the community, and having those people who have amazing drive and motivation and smarts about their own community to do the work for themselves in their community, and give them sort of a collective impact goal so everybody has a shared vision, and kind of take it from there. And I'll let Dom talk more about the details.
I so appreciate that, because again, in the circles I work in, part of discharge planning, it being in the hospital, is to make sure that the person who are discharging has the resources they need to go home to continue their care. And what I love so much, a million things I love about this, is that you've actually connected the dots. Because the part, to your point, you can have all these services and people doing their own thing, but if it's not coordinated, and if it's not a collaborative effort, then you've got a lot of people trying to do a lot of good things, and it ends up kind of being a salad, that doesn't really work. So thank you for that. So Dom, now I would like for you to kind of walk us through 100% Community and that roadmap, as it were.
All right. Well, we'll start with a visual aid. 100% Community, free to download right now. You can start reading. I guess I want to say that before I kind of lay it all out, is that I think before COVID-19, there was a common phrase that was, refer people to services, or in child welfare, it's refer parents to services. I think we've all heard it. We've used that phrase, and as Katherine says, no one has bothered to ask if those services exist. And what we've discovered, county by county, because we do a survey to ask people, do you have access? And it's not surprising that people don't. And I think, especially the phrase connecting our vulnerable residents to services, I think with COVID-19, all of us are vulnerable. I think we learned that suddenly, one governor's sentence, and we may not be able to get to a doctor or to a store to buy bread, or we're living, I think, in a time that most of us couldn't imagine. So things changed quickly. Things changed quickly for the middle class, and of course for those who are working class or the unemployed class. They've been struggling forever. So I think this phrase, we're all in it together, has never been more true. And I think that the book 100% Community, guiding the initiative and ideally guiding the movement, is something that could be transformative for not only every county, every state, and ideally every nation. In terms of just the basics of the book, for those of you who are wondering, what exactly is this thing? I would say this is the most radically simple idea you will ever hear in your life. Radically simple. What do I mean by that? As we've said, humans need 5 services to survive. Just 5. If they can have food, secure food, if they can have stable, safe housing, if they can have access to medical care when they need it, if they can have access to mental health care when they need it, and if they can get transportation to these services, people do better. They survive the day, the week, the month. And no one disagrees with us. As Katherine and I have talked a lot for years about this, everyone will say, well, absolutely, those 5 survival services, everybody should have access to that. I think where you get into a debate, if you talk to your mayor or your county commissioner or the governor's people, is we earnestly want them to have the services. It's just not our job necessarily to make that happen. Like, the question is, whose job is it? So those are the 5 surviving services. And just to be clear, we want people to do more than survive the week. We want people, families, all community residents to thrive, even even in a pandemic, even in economic free fall. If we work together, we can thrive. And that would be parent supports, early childhood learning programs, fully resourced community schools, youth mentors, and job training. So these are the things that the 100% Community book and initiative can bring to your county. And I want to stress that for a lot of us who are used to surfing the web, we see articles from across the world every day. Many of us want to save the world. Some of us want to save the nation, maybe the state. Katherine and I taught a lot about this. Let's focus on our county, the county we live in. We can drive to its borders. We can survey everyone in that county. We can know what's happening there. That's why this is a county model. And if we work county by county, there are only 33 counties in New Mexico, and New Mexico is going to be amazing, and only about 3,000 counties in the United States. So this is a model that can move county by county. And to kind of wrap up at least this overview, the book is divided into 4 parts. Part 1 would be a general overview of the problem. A lot of this is about root cause analysis, really digging deep in terms of why do all these problems exist. And to be very clear here, as Katherine said, and our other speakers will talk about, if you could imagine any social problem that you want to deal with, this could go from bullying to human trafficking to substance misuse to trauma to elder abuse. You name the problem, get these 10 services in place, you will see reductions in that problem, significant reductions. So instead of, in a community, 1,000 people all working in silos on different problems with different strategies, if you just raise these services up and make them accessible, the problems fade away. So the first part of the book is an overview. The second part of the book is all about partnerships, and we take you from your relationship to your governor and the governor's people, to your state senator and representative, to your mayor, city council members, school board members, county commissioners, and lots of folks that will influence how easy or how difficult it is to get these 10 services working well. So you really need to know your partnerships. The third part would be the nuts and bolts of the initiative in terms of, as Matt is showing us with San Miguel County. And we also have some of our favorite peeps from Socorro County and from Otero County wanting to start, Doña Ana County, Rio Arriba County. It's the nuts and bolts of how you bring people together, how you form 10 teams, each one focused on one of the sectors, how you use data, how you use technology, and ultimately how you collaborate across sectors. And then lastly, the last tiny 300 pages of the book would be looking at each of the 10 sectors. How do you look at a sector like behavioral health care? How do you assess that in your county? Where are the gaps in services? What do we have to do to fix those gaps? What are the public and private sector partnerships that can help you here? And how do we measure success? And for those of you who don't think they can take on 600 pages, if you go to Anna AJ, 48 hours ago, Katherine and I literally launched mini books. So if you only want to know about behavioral health care sector, you can go into a mini book and get through that in about an hour and a half.
Oh, so don't let them off the hook that easy. I want them to read the whole book.
Oh, yeah, well, we want you to read it all, baby steps. And also, these books are going to be wonderful for your partners. They may not be actively involved in the 100% Community Initiative, but they want to know what's going on in their sector. They want to be engaged. And the more the public, the more county residents are brought into this conversation, the stronger the initiative will be. So, yes, we want everyone to read all of it. That's about an 8-hour read, or Matt might say three plane rides, and you're there. As long as you have some banana pudding and coffee nearby, I think you can get through it. But the mini books will be a wonderful tool, and again, free to download from our website. And if people do want Kindle or they do want print for the mothership book, that's available, on our other site, and those URLs will be made available.
Yeah, I appreciate that. One of the things in the part 1 that I loved, and you sent me your illustration, is we interrupt this public health crisis to share another one. And so here we are, and I want to kind of move into where we are today. I understand from Matt that 100% Community San Miguel County, you guys were ready to go with your original initiative, which was to address childhood trauma. And then that was January, and then COVID happened. And so, Matt, if you could, you walked me through the process, and I think it's important for everyone. Thank you for those of you who are just joining us now. This is being recorded, so if you've missed the first part, you'll be able to have it afterwards. So, Matt, when COVID hit, your county, and we have so many people from different counties here, and you have this book. Tell everyone what you did next to actually, bring together your coalition. I know there's some other terminology that you all use. So what were your next steps, and what was your aha moment saying, I think we have what we need? No, that's not you. You say, I know we have what we need. You don't say, I think. You say, I know.
Well, yeah. So, it's what you said, though. We had started pre-COVID. And so we had, after this was the decision, yeah, we're going to do this. We're going to have this in San Miguel County. Kat and Dom asked me, can you be 11? Can you find an action team leader from each of the 10 sectors to be with you as an organizer and really form a coalition to start working together, get all on the same page, read the book together. So organize, Matt, bring folks together and then start working on getting through this framework together. So we started with that, but 11, our style, we have big families, and so 11's not a big family. So for us, 11 became, I think it's 42 now, action team leaders, because in each sector we needed, we had co-leaders, and also we did things differently with a co-organizer. So Sheriff Lopez helping me with that. So we had already been working through the book. We had a book club, and with book club we went through each of those 4 sections that Dominic talked about together. And as we were in section 3, I think it was, COVID hit. And we're sitting around tables still, something we haven't been able to do for a while, and saying, oh my gosh, what is this going to do to childhood trauma? Oh my gosh, what is this going to do to everything? And we need to shift gears. And what's beautiful is that we have a framework that was designed that can be developed, it can be magnified, multiplied. This framework, we can really take it and redirect it to any public health crisis. So yeah, the childhood trauma epidemic, informed by, the HIV/AIDS epidemic, informed by 9/11, informed by now, how do we take this and push it over to be able to address a pandemic? And so it was a natural move. And as we did that, the energy just multiplied, because again, we started having solutions. We had teams formed. We started having teams formed saying, well, how are we going to address this in education? How do we make sure everybody has food? What do we do with transportation? What are we doing in medical care? And we have, those mini books. We've now multiplied the medical action team to 7 counties to expand COVID testing and response. But that started, and that's really where my co-director came in, Sheriff Lopez, where it was at that point where again, it was like, we need to force multiply. And so Sheriff Lopez, will you help with this initiative and all the connections that you have to really take this initiative to be able to respond to COVID to a next level? And so that's really how it happened. So now we have hundreds of individuals, dozens of agencies, including San Miguel County, working together to address a pandemic. So that's really where it was. And there's a structure we follow. We all have action team meetings. They occur last night. I was at the food table. So food met last night at 7 p.m. Every group meets regularly, and we meet as one big lead team weekly as well. So, but yeah, with that, I'd like to have maybe Sheriff Lopez give his perspective.
Definitely, Sheriff Lopez. So, and I have a graphic I hesitate to put up because I don't want any technical difficulties, but I'll try and do that before the end. There's this really great org chart, and on the org chart, there's the food. There's, Dom, you'll help me with, some of those. But then where you come in, Sheriff Lopez, where did you see the advantage of you becoming not just aware, but involved in this initiative? And if you could kind of describe your role in this and, what you see the group accomplishing thus far.
So thank you. Can you hear me all right?
Yes.
Okay. So, a little bit of history, and I think Matt kind of talked about it a bit, but we've worked together along with Dr. Blea on several initiatives and ideas and ways that we could strengthen our community and make it a better place with the little resources that we do have. So as we started dealing with the COVID, Matt brought up the 100% community initiative to me, and of course, in order to make anything work, you have to have a real buy-in. And so he started explaining it to me and provided me a book. I started looking at it, and initially I was a little bit hesitant because, through anytime we're dealing with disasters or emergencies, we have plans in place. We have response plans. We have our Office of Emergency Management, and at the state level, we that's the way we're trained. That's the way we're taught in law enforcement emergency services. And so initially I can say I was a little bit hesitant, but myself and Matt, we've worked together closely, and we've established a really good relationship over the years. And he kept telling me, just, really look into it and let me know what you think. And so, I began looking into the book and really looking at the ideas behind it. And I realized that, we have all these services in place already, but how available are they to the public? And in terms of a health crisis, how ready are we in terms of emergency management to respond to that? And so there's a little bit different circumstances here, something that I've never dealt with in my career, and I don't think many people have. And so as I started looking at it, I was like, well, I can definitely see this working, but in order for it to work, we have to have some buy-in, and through our efforts and through our careers, we do have a lot of trust from the community in our actions. And so I felt in order to make something like this work, I felt like I needed to be a part of it so I can get the buy-in from all levels to make it something successful. And that's really where I felt like I needed to in conversations with Matt, that I really felt that we needed to team up on this to make it a voice that people listen to. And since then, we've really been able to get people to buy in and get collaboration and somewhat of a structure, which is, again, the framework of the 100% initiative. That's all in place, so it's really made it easy. But again, as you move forward, you're going to have people that aren't sure, just like I was, and you have to be able to provide them that security and that that information that they need so they can buy into it and look at the book and really believe in it. And so far, we've really seen, we've had our moments where we've been frustrated, and we've had our moments where we have to really step back and reevaluate things. But anytime you're implementing something new, you're always going to run into that. And so it's been really exciting for me to be a part of this and to really show people that through efforts like this, you can make a difference, and it really shows in terms of our COVID response here in San Miguel County.
I appreciate that. You said a key word that I wrote down. I've been thinking about this. I told folks when we opened this morning that I listened to a really brief conversation between two pretty brilliant minds, and they were talking about what they saw, what their hopes were, and what they saw as silver lining. And one of the things they said was that at a community level, they see that, one of the things they were saying is they're particularly concerned about Gen Zs and, kind of how they're going to end up through all of this. And part of it is trust. That was the word you used. And one of the things that excites me so much about this is that we can all agree that in today's times where we're living in, and you said, Dom, a few minutes ago, there's so much you can get online. At the end of the day, who do you trust? What information do you trust? And I have to believe, and I'm sure you have evidence to back this up, that a community initiative where it is born and raised and nurtured within the community, that has an inherent sense of trust, an ability to create trust. And that might help people your initiative is no good if people aren't able to utilize those services. And what's going to help them is to have trust in the partners that are collaborating. So Kimberly, I would like to hear from you because Sheriff Lopez he's on an action team, and Kimberly, you also lead an action team. And if you could unmute yourself and share with us your role around this 100% community table.
Sure. Thanks, Michelle. Can you hear me?
Sure can.
Wonderful. So similar to what Sheriff Lopez and Matt shared, a little backstory. I have the privilege and honor of serving as the Dean of Students at New Mexico Highlands University. We are a rural institution, a comprehensive public institution in the northeastern part of the state, and we serve a lot of first-generation low-income minority students. And so when we look at meeting, I use the term meeting students where they are. When we look at that, we, in essence, kind of provide already at the institution a community school model in which we provide access to medical and behavioral health care. Fortunate to have contracted with El Centro, probably I think we're already going on 20 years, even before it was El Centro for that. So we have a long-standing relationship, but I took the approach in my position in really looking at how we support students' holistic well-being. So the buy-in for me was already there, specifically with our college students. Now, being from the community, having young children who attend local schools, I recognize that I have the privilege to be able to utilize my resources and capacity in my position to help my community. So when Matt approached me about 100% community, he said, I want you to be a team lead for the community schools, for the education. Naturally, it's just something that's always made sense to me at the collegiate level, but looking at how we would be able to implement that with our youth in the local schools. I do have to say that I'm the type of person that understands. I have a master's degree in public affairs, applied sociology, and my doctorate in educational leadership. And so I understand, the social determinants of health, social justice issues. And I have to tell you that in one of our meetings, I had this aha moment. I have, I guess I will call it the privilege of addressing student disciplinary issues at the college level. And I had this aha moment when I said, if we would only go upstream and work to, support students who have these adverse childhood experiences, then when they get to the college, the university, we won't have to be putting so many resources into them. We won't be seeing as many mental health issues going untreated. And so for me, I had this aha moment and I said, perfect, let's really focus on a continuum of services throughout the education system, PK through 20. This 100% community initiative provides the perfect opportunity to do that. It's the roadmap, the recipe book, however you want to call it, but it tells us exactly what we need to do. What stakeholders need to be involved? How do we engage the different individuals? And so for me, being able to serve in this capacity really allows me the opportunity to also work with my colleagues on the academic side of the house to make sure that, we're developing programmings and having internships and practicum placements for students that are based on what our community needs. And so being a team lead for the education or community schools has really been a privilege and an honor to be able to serve the community. So that's kind of how it got started, how I got involved with it, and kind of how it dovetails with my work at the university.
Thank you. Now, I do want to kind of get more into the bones, if you will, of the book. But one of the things I want to ask you, Matt, if you could kind of walk us through. So I shared with our podcast listeners that I had the honor to listen in. I was a fly on the wall in one of your weekly meetings that you have. And I don't even know how many people, I think I counted 30 something that were on that particular call. And everyone had kind of their own, so you made the shift to respond to COVID and everyone kind of had their place, what they were in charge of. Can you kind of lay out for us what the action teams are working on, you started working on with respect to COVID, and kind of where you are now, what you have accomplished, and how you're preparing for what's next, whatever that is?
Yeah, and I think it's back to the starting question. Can this be done? Can this be replicated? Still, in response to COVID, can other communities take this on and have fruit? Yes. So everything we've done, we've only done in a couple of months, and that started again. It just starts by connecting people. It's about organizing, connecting people, having a place. And again, every community probably has many different meetings. Yesterday I presented to 4 or 5 different groups, whether it's Kiwanis or it's, other things going on in our small community, and the health council, those types of things. But they tend to happen, those initiatives, and everyone has initiatives and great people. And many of those people were on multiple meetings, but oftentimes what you see is that initiatives are happening in silos. And so even within a small community, how are we not replicating? How are we not, as Dominic said, making sure that we're not leaving major gaps? And so I'm the chief quality officer, so there's quality behind this initiative. As a quality officer, I love that. And so, it's gap analysis. It's, first of all, the first gap is, well, not everyone's at the table. We want every agency that's doing medical care, that's doing mental health care, that's involved in food distribution at the table for youth mentoring, whatever it might be, at that table. And so a first challenge is making sure we have that outreach to bring everyone in. And there's always that also, there's a sense of competition. And if we were able to do this in an election year, when there's local elections and all of that going on, where there's this other interesting dynamic of competition, yes, believe me, it can be done. Despite all of that, a place where people can feel that they're welcomed. It's a place where you share your initiatives, or you want to be part of other initiatives. And when you share those initiatives, you get a turbo attached to them. They really just get taken to the next level. So that is that part. It really is these action teams, which is just about 5 survival services, 5 thriving services. I don't have extra digits, but if I did, we would add 2 more in COVID response. Emergency management, as Sheriff mentioned, we're not replicating the emergency management plan, we're supporting it, and I'll explain a little bit more about that in just a minute. And then very, very important right now is economic development and what's going on with our small businesses. So we really have 12 action teams, the 10 that services, and then you take those, and if I had extra digits, I would take those 2. And where 100% really happens is when you start weaving those together. We all know really well how to cross agency collaborate in our lanes and in our sectors. That's what we do. Education, they collaborate, especially in small communities. But it's really something amazing when you start seeing education collaborating, and you can't separate health and education anyway. So why did we ever try, right? Much less with job training, much less with, with transportation, with food. So that's really, really the excitement there. Along with that, and again, led by Sheriff Lopez. So we developed a call center to really enhance emergency services. So you call 911 because your Obama phone, when it runs out of minutes, that's the only number that works. When you're a person,
can you explain that so people understand what you're talking about? Yeah.
So if you don't have access, all of these things sound great, but if you don't have access to the internet, it's not very helpful if there's a website to go to. If you don't have a telephone, it's not very helpful if there's a call center to call. So I just want to, it's really just a point back to that lens. Is it accessible, is what the sheriff said. You have these services, but are they accessible? So, as people are at stay-at-home orders and they have Obama phones, these cell phones that are given to them by the government, and when they run out of minutes, and when they run out of minutes, the number that still works is 911. So, you start getting dispatch at 911, receiving a call saying, not I need an ambulance or a police officer or a fire truck, but I'm out of food.
Wow.
So how do you make sure that our dispatch, which is also under-resourced, doesn't get overrun with those calls? Well, we created a call center. Sheriff Lopez led that initiative right out of his office. So now we have a call center that's about access to 10 vital services along with the website, right? So 911 dispatch can take that call, transfer that call to the call center. We have a website that is also our resource guide, access to 10 vital services, all the agencies that provide services within each of those sectors listed on that website. But the resource guide is not just a resource guide. It's an assessment tool back to identifying gaps. So when you have the resources listed, and many of you know, there's so many resource guides out there, but there are major gaps. Yes, there are so many wonderful people doing wonderful things in this community, but is food available every day, 3 times a day, 7 days a week? What about access to anything, any one of those things, there can be gaps. And as you start to put together that resource guide, you start to realize, well, there's major things that are missing. We don't have a domestic violence shelter. Well, we need to do something about that. So it's rapid cycle, plan, do, check, act, rapid cycle PDCAs, if you will, to really say, wow, we've identified a need. Let's now attack that with a vengeance in a very short amount of time, because in responding to a pandemic, everything is, the equation is over time. So remember math. If you put it over time, time becomes the most important factor. So it has to be rapid, but it has to be well thought out. We don't want to just be random, is what Kat said. Doc said, we don't want to just make random assumptions. We need to use evidence to drive and guide forward change. And so, there's that, so in a very short amount of time, we have 12 action teams, all with their own initiatives. We have a lead team that meets every week, and we have certain initiatives that are joint initiatives of the full lead team now. Mask making initiatives, helping small business initiatives. We're taking on another one, which is going to be this very fun summer masquerade thing for giveaways for youth. And different initiatives that every sector can have a role in doing that. With that, we have a resource guide available to the community at a time when they need resources more than ever. And we also have these action teams working together to identify, okay, that's a good start. And if we can feed 500 people, that's amazing. But if there are 60,000 residents and 30,000 of them need food, we still have a lot of work to do. And it's going to take a lifetime to do that. But how much can we get done within a couple of weeks? Because, people need things today.
So real quickly, because these are two stories that I picked up on when I met with you all. Masks and hand sanitizer. These are things that we're talking about in our homes every day. And, Matt, I think to your point about economic development opportunity, just share a little bit about that initiative, about the mask making, because I think it's a good one, and it's a debate. Obviously, everyone's talking about it these days, so we might as well talk about masks, face coverings, if you will.
Yeah, and we won't get into the debate, but in New Mexico and in the city of Las Vegas, it's a public health order. If you're out in public, you need to wear a mask. So let's just take that as a given, and then let's start talking about 100% style. How do you address that issue? So first of all, you get a lot of master sewers out working to sew a bunch of cloth masks, because we don't, again, any of those issues that people are trying to publicize out there and make a big deal of is, well, no, they said we don't need masks. Well, those were early on fears of that. If we had all the public using masks, how are we going to have enough surgical masks and N95 masks to do healthcare? Because without those masks, we can't do healthcare. So let's talk about cloth masks. Let's get cloth masks to the public so that we make sure that we're not inhibiting our supply of surgical masks and N95 masks for healthcare delivery and emergency response and first responders. So there's that part of the initiative. And as soon as we started talking about, well, let's give away all these masks, we realized, hold on, there are folks out there in our communities that are out of work that have been making masks and selling them just to put food on the table. And what a tragedy if we were to give away all these masks and now take away the very little income that some of these people have. So we applied for a grant, and our idea with the grant is to stipend mask makers. Now, many mask makers are still, they're just going to give their stipend right back and it'll go in the kitty. But for folks that need that income, now we can really have that initiative to be making masks. And now we're taking it to the next level, back to, there's not a lot of economy here to begin with. There's not a lot of business to begin with. So could we have a properly socially distanced location with sewing machines properly spread out, where folks could actually, if they didn't have sewing machines, not only do we give them the supplies, but now they could actually go and have a place where they can sew and make a little bit of income. And then after mask making, eventually we think the day will come where mask making will move on from mask making and be able to make things that would be important to our local community, back to maybe some things that would help with tourism. For small business, we're looking at, advertisement. So, our small businesses are starting to open slowly, 25% capacity currently. And so, but you have to wear a mask to come in. That's the public health order. So if somebody shows up, we're hoping it doesn't become a go away, you don't have your mask, but more like, here's a mask, come on in, you're welcome. Thank you for coming, and here's a mask. And even better if that mask has the local business's advertisement on it. So now that's something our Chamber of Commerce is working working on with small businesses to have masks to give to their patrons that also then advertise their local business.
And then I understand
so that's 100% full circle.
Same with hand sanitizer. So Kimberly, it's my understanding that you all have a lab, and so something happened there as well to make up for the shortage of hand sanitizer, correct?
Definitely. Thanks, Michelle, for that. So I got a call from Matt who said the detention center is out of hand sanitizer. They're going through it quickly. Is there anything that Highlands can do to support this? Fortunately, we had already started the initiative where our chemistry department was producing hand sanitizer. And I don't know, Matt, probably within about 30 minutes, our campus police dropped a load of hand sanitizer off at the detention center to meet that need. But it's because of the connections and the collaboration and a few phone calls, we made it happen, and really, you know, cross agency supported that need that existed.
So those are just a few examples of, you know, small but really big things that have a big impact that you all have done. Dominic, I want to come back and turn to you on this question because unfortunately Senator Campbell was not able to be here with us. We were hoping that he would be here because he is also part of your coalition as well. And these all sound like great ideas, and it takes a lot of, you know, community organizers, everyone on the same page. I know that we're going to talk to you a little bit about how you facilitate that initial conversation. Why is this initiative it should be of such interest to legislators? I was sharing with the group, you know, we go to DC every year in February on behalf of the National Rural Health Association to ask members of Congress to sufficiently fund, hopefully permanently fund these health organizations, health initiatives. So why is 100% community important for legislators? And why is it so important for them to become involved from the very start?
Well, that's a great question, and the other panelists will have a lot to say about this as well. You know, people run for office because they care, and they, as I said earlier, you know, Katherine and I have talked to hundreds, I want to say thousands, hundreds for sure, of elected leaders on every level, and again, every one of them agrees. No one has disagreed. These 10 services should exist. They should exist in my county. And again, the dialogue is who makes that happen? Whose job is it? You know, I have a very good friend who's a mayor who was one of the first people to read the book, endorse the book, promote the book. And he said, you know, Dom, you just need to understand how government works. You know, it's not designed to make sure that these 10 services work. And I said, I'm not saying the city funds 10 services. What I'm saying is the city uses its power and it leverages its power to nudge all the other public and private sector agencies to work together to ensure that these work. So again, we're 100% community doesn't say that the city funds all this. That would never happen. But a city has a lot of power, as does county government. And it's in some ways, I think that to be sympathetic to our elected leaders who are now faced with a pandemic and economic freefall, it's like, wow, I didn't know that I signed up for this. You know, I think there are like 7 colliding crises right now that no lawmaker signed up for. So whether or not a lawmaker has the philosophy that, you know, we want everyone to do well, but you're on your own and we really hope you fix yourself. Or we believe government plays a vital role in making sure everyone's okay. That's a pretty big continuum. That's been a conversation in the United States for hundreds of years, the role of government. I think with 100% community, what we're saying is, let's just agree that these services, if they exist, people do better. Ultimately, government saves money because it's really expensive to deal with all the problems that come when you don't have these services. So I think that why is it important for a lawmaker on any level to be engaged in this conversation? I think it's a historic opportunity. I think what we're offering is a radically simple model that is groundbreaking, that will ultimately transform every county and every city. I think that with the pandemic, we have no idea where this is going. You know, I'm old enough to have lived through another epidemic called AIDS. Mm-hmm. So I know what it's like when an epidemic hits and really, really severe things start happening quickly to lots of people. And we don't know when the next virus is coming. We don't know how lethal it will be. So it's in our best interest, all of us, to be as prepared as possible as we can be. Now, coupled with that, why should a lawmaker care? A lot of lawmakers really care about the economy. They really care about business. Some of them really only care about business, and I think that's great. But in economic free fall, we're going to need some new models here. We're going to need some new strategies. And this is where technology comes in. And that's also a big part of our book and a big part of this initiative, which is what role does technology play in delivering these 10 services? And as we've discovered in social isolation, you know, there's a lot you can do from your home, right? So we can look at all 10 services one by one and say, if we use technology, can our services be provided in a better way? Also, can we finally get rid of the digital divide so everyone has access? So I think that's my long-winded response, which, why should a lawmaker get involved? Well, we believe lawmakers' role is to serve the public, and there's no better way to serve in an epidemic, a pandemic, an economic freefall than supporting a model that brings everybody together on a local level in a way that's measurable to ensure that all of us are safe.
Yeah, I appreciate that, because if we've all seen, you know, I've had the opportunity to interview Alan Pratt, who is the executive director of the National Rural Education Association, and we had a conversation just about, you know, what this has done for access to for students to, you know, driving to the parking lots with their parents and trying to eke out some bars, you know, to do their assignments and whatnot. I want to talk a little bit, a couple of things, the economics of this, and I also want to talk about the communication aspect, which is, you know, very much my own self-interest. I admit that. Just from an economical standpoint, Matt and Sheriff Lopez and Kimberly, any one of you can chime in on this. Matt, you mentioned you applied for a grant, and I think, Dom, you kind of touched on something where people think we can't really afford to do all of this. So what has been the economic impact for you all? Where did you start to look for resources? How did you maybe put a kitty together? I'm just curious, because this is a lot of people serving a lot of time, and there are things that simply, they cost money. And you can't, you know, hope for all things to happen without paying for them. So talk about the economic scale of this, if you will, the three of you at some level. And then I want to kind of get into the communication strategy once you are able to bring people to the table.
Well, for the economics, I would say that, yeah, I mean, it's what we said earlier. We're used to doing a whole lot with very little. So there's one thing. And then there is another thing, which is if you ever want something done, you ask the person that's the busiest. So you have a lot of very busy people on our action teams, and they're people that do things, because if you want things done, you have to ask people that actually do things. And so it is a lot of just individual time, talent, and treasure right now. You know, again, people say, well, how much did all that cost? Up until now for San Miguel County, nothing, zero. It has been all on our blood, sweat, and tears. And you know, I also just want to say that it's within all of us. We want to do something. It's a pandemic. We want to help people in need. That's what drives us. So it's an opportunity for those that are driven the same way we are to have an outlet and to be able to use that outlet to do a lot of good with whatever efforts that they can give. And so that's the start of the economics. It's old-fashioned. It's about neighbors helping neighbors. It's about really, really roots of rural communities, and you don't need a lot of dollars. Now, don't get me wrong, dollars help. And I think that's back to why is this important for legislators, for Senator Campos, who again, you know, had emergencies to deal with, so wasn't able to be on in the end, or Senator Souls, who wrote the forward in the book, Senator Ortiz-Pino, who's been very supportive, and others. I don't want to leave anybody out, but those are three major supporters supporters, is that now when there are less resources than ever before, as we move into a special session of the legislature in New Mexico, we need ideas like this that can make a lot out of a little. And so I think that that's an important part of it. We're blessed with Highlands University not only to serve as our physical home when we were able to meet in person, to let us use their Zoom for our virtual tables now in our meetings, and to have, you know, great leadership like Kim, and allowing their staff and faculty to serve on action teams, and let us use their chemistry lab to make sure we make hand sanitizer for a community, you know, those types of things, but also now serving as our fiscal agent as we move forward. So with that, you're right. Eventually you need resources. And when you can do a whole lot with little, imagine what you can do if you get real resources. So we're very excited about that opportunity. You know, with that, we've had some little small donations now, and so we're actually, as we speak today, setting up that ability for anyone out there that would want to donate to this cause. As I started off by saying, it's about trying to get resources for our home county. And so anybody that's looking to try and give a little bit and watch a county stretch it a long way and do a lot of good. For now, you can get a hold of me through our website, and again, we'll share those links later, but that's anaaj.org, and specifically the San Miguel County one is where you'll find my email. But get a hold of me by email if you want to give. Soon we'll have that, you know, PayPal account where we can take donations. We'll be seeking more legislative funding, and Katherine and Dominic could speak all about this being a state legislatively sponsored project. But yeah, I mean, resources, economics are important, and all of this is economics. If you can't have students back on college campuses in little small towns where that's a vital part of the economy, that's very destructive. If you can't have small businesses reopening, that's destructive. So, you know, everything that we're doing is really about economics. It's not a competition of, you know, medical against small businesses. I know, you know, there's polarization out there in the media trying to pin that battle. That's not true. It's all of us together with one goal, you know, providing access to 10 vital services, including small businesses, and doing so safely so that we can do that, all of us together, united with one purpose.
Yeah, and access means different things to different people. It's also part of what you're doing is really helping people navigate these services. That's the word that comes to mind. Kimberly, I have a question for you, and then I want to get into some more about the book. In a lot of the hospitals I work with, they do a lot of great community outreach work with the goal of engaging community and better behaviors to promote wellness and whatnot. And so they'll do things, and then they'll ask for volunteers, you know, so they'll have, they call for volunteers from within the hospital. It's usually the same group of people, and it's kind of maybe the way they're wired because they're very community oriented. And so when you approach your team at the college about participating, and Sheriff Lopez, this might be for you as well, it's something that you say if you guys want to do this, or is there some strategy that you put in place that I hate to use the word mandates it because it sounds so punitive, but what is the strategy for engaging your teams and seeing this as a part of an extension of their role and not something that you're asking them to do extra? Because I imagine that could be a challenge when bringing some of these stakeholders to the action tables.
Absolutely. So what I will say first and foremost, and I say this often and people know that I say this often, Highlands University could not survive and thrive without the city of Las Vegas, county of San Miguel, and vice versa. We are the largest employer, one of the largest employers within the community and the county and the surrounding areas. So for the university, being a good community partner is part of who we are. It is one of our strategic goals in the university's strategic plan. We're going through a whole strategic planning process currently. It was in the last plan and it's proposed to be in the upcoming plan. And so from the university's perspective, if it's part of our priorities as a university to be a good community partner, that's already entwined into people's work. So that's kind of the approach that we use, you know, that's within your work. Obviously, you know, some people are really excited about volunteering and doing things beyond their, you know, regular work, and others not so much. I always encourage my staff and my colleagues to really emphasize the community that we serve, the students that we serve, and really emphasize the expectation that we be good community partners, and recognize that we do have, because we're a large institution, larger in the community, we're a small university, but we do have resources, we do have, facilities that people can meet in, we do have Zoom links that people can use, and so that's kind of the way that we approach it. I will also say that our executive leadership, under the leadership of Dr. Sam Minner, our president, he does require and expect that all of his direct reports, his leadership team, does do some sort of community service. And so that in itself is also, the expectation is set there at the top, and then it trickles down. I encourage my staff to do the same as well. We're also looking at how do we integrate the classroom and the academic curricular experiences for our students into the community? What does that look like? And so approaching it in those ways are things that we use to motivate and incentivize the university employees to get involved. And at the end of the day, I will say that it's just the right thing to do. To be in service of others, to be in service of our community is just the right thing to do. And so that's kind of how we approach it at the university.
So Dominic and Katherine, I want to ask you this. I mean, you're very focused on the data, and that's really important for people to continue to stay engaged. They want to see how it's actually, everyone's self-interest is met in some way, shape, or form. When you start out a community in the process, can you take us through your process? Matt talked about his process, and you contacted him, but walk us through what you do with a group, kind of some of your requirements. I know one of the first things you tell them to do is to read the book, but let's kind of dig beyond that and talk about how you prepare a community, a county to really be ready to take on this initiative, because it's not something that you could just dabble in. You won't get the results that you're looking for. You have to go all in. So walk us through that process.
So every county is very different. I will say we've worked in probably at some level 5 or 6 counties at this point, and 1 Pueblo. And every single county is different. It kind of goes at their own pace. San Miguel is obviously a superstar and just went really, really fast and got all the people together. Also, since having the book out helps a lot, because everybody can literally get on the same page. So like you said, one of the first steps is really, can we get people to read the book? If we can't get people to read the book, it's probably not going to happen. It's just not, if people don't have enough time. The other thing is finding, exactly, finding those kind of activated people like Kimberly, like the sheriff, like Matt, who are just going to do it and not going to sit around and wait for funding. And every county that we've worked in, it started with someone asking us, can you come present? Can you come talk to us? Can we see if our county wants to do this? In the case of Matt, we were invited by a university out there, not Highlands, the United World College, sorry, it's not a university. They invited us out, Matt was there, and that's how it happens. There's someone in the crowd, someone that's invited that says, yeah, we're doing this in our county. If you don't have that, it's not going to happen. So there's been counties like Santa Fe, where we live, where we don't have a map. We have a lot of people who are very interested in what we're saying, who are saying, yeah, this is a good thing, but we don't have that person that can go out and find those true believers and get them at the table willing to do the work, without waiting for funding, without waiting for someone to kind of push them. So those are kind of the key ingredients, is really the people and the community, and it has to be that drive. Our original plan when we started talking about an institute was, we came up with budgets, we came out with org charts, what would it take to make this work in counties, and we had originally thought, we probably need like $1 million per county, we need to pay someone to do this full time, we need this and that. What we found is actually we don't need that. We need the people who can do the work and are willing to do the work. And we've had in New Mexico a long history of people coming in, getting grant funding, getting paid to do things for a certain amount of time, The money runs out, they leave. It's not sustainable. For our model, it really is important to have the people in the community being the ones doing the work and finding the funding, finding the means to do it, because that just builds sustainability into it. It's not going to go away when the money goes away. It's going to keep going. So it's really, you know, it doesn't take a lot. It takes people who are willing to put in the time and have the passion to help their communities.
Yeah, and I would imagine I'm sure you considered it, because I'm going to admit I'm not all the way through the book. At the end of the day, if Matt leaves, and this is something that we talk about a lot, you know, everyone needs a succession plan. If Matt leaves and someone takes his, you know, steps in his shoes, and then they say, well, this is not of as big of an interest to me, I have other pursuits. Or if Sheriff Lopez, someone replaces you, and so forth and so on. So what kind of insurance policy, if you will? I mean, how are you, you know, what are some of the, yeah, Matt, what's your insurance policy?
Well, it's already built in. It's built into the model. So yeah, I've been, you know, very not as engaged as I was at the beginning over the last 4 weeks. Again, as I said, I was called upon by our governor's office, by our Secretary of Health, Secretary Kunkel, so we did an amazing job in San Miguel County. You know, for those of you that don't know, New Mexico is one of the leading states in the nation, if not the leading state in the nation as of Friday, for COVID testing. And so with that, San Miguel County is one of the leading counties in the leading state in the nation. And that is because of 100% community. And so we did that very early on. We've you know, been doing that since early April. And so when it was identified by our Department of Health how successful that was being, I was asked to replicate that for the full region and to get that going for all 7 counties that El Centro serves. So that's been a big project. It will be complete as of 3 o'clock today. We'll have 18 testing sites up in very rural northern New Mexico. Those are 18 new testing sites in addition to our public health offices and our regional hospitals that we have in the service area, so that we can really serve our frontier communities. And so that project has taken a ton of my time. And so early on, I was engaged. I was at every action team meeting, not just the lead meetings. And now I just can't be there. And this thing has a life of its own. It doesn't need Matt anymore. I mean, this thing is growing without me, and it's young people doing it. It's these, you know, our future health professionals leading initiatives, and it's professionals like Kim Blea and the sheriff. But I have no worries. I think with or without me, this thing, it has its own life now, and it just needed nurturing, just like any seeds. And once it started to grow, it's going to bear a lot of fruit, and it'll kind of just keep feeding generations for generations to come.
Dominic and Katherine, is there an actual, you know, when you convene and everyone's agreeing, they're on the same page, they're excited, they want to do it, do you actually have a recommendation? Do you have an agreement in place? Is there an actual physical structure of the coalition, if you will, so that, you know, there's kind of this living, breathing document that shows who all is involved and the shared commitment? And while that might not hold up in a court of law, but I'm just curious, you know, how you put together a structure, you know, again, because I think in those who I work with, these would be some of the questions they would ask, is to understand, you know, what kind of obligations, if you will, that others will have. Because I hear a lot, well, if they don't do it, then I'm not going to do it, that type of thing. And so I wonder if you could walk us through what that might look like.
Want me to go, Dom? So Matt described at the beginning, it's really, we need action leaders for each team, and in some counties that's 2 people, and some counties it's 1 per action team. Some counties don't even have, you know, they have multiple people or multiple teams per person. It varies by county. But the key is kind of at least having representation from each of those sectors and having co-organizers. So a Matt and someone working with them to make sure the work happens. We found the synergy between 2 people is really helpful. In some of our counties, there's just 1 leader, and that's fine too, but it does work a little bit better to have sort of that tag team ability and the ability to kind of call on someone else, bounce ideas off of other people, and share some of that load. We do have an org chart. We have a readiness seminar that we were just getting ready to do in 3 counties right before the pandemic hit. So we have a lot of tools developed. We have a lot of sort of guidebooks. A lot of it's in the book and the appendices. We have things like org charts, logic models, governance structures, things like that.
So let's talk a little bit about the data, because obviously, Matt, what you all are doing, I'm wondering how you are, because you cited some statistics about how many the testing that you're doing and so forth. And maybe this is too new, just in terms of the 100% community initiative, but how do these different teams, what's the mechanism to report data, and what are you looking for? What are your benchmarks? How do you know when you've, you can physically see in front of you that you've moved the dial for the better?
Yeah, so with that again, there's a structure for each action team and what their role is, and again, it's about gap analysis, and so once you're in gap analysis, then you actually want to say, well, how are we going to measure this? And so we've had already several very successful initiatives in that. So you have kind of, especially for a pandemic, you've got immediate goals, intermediate goals, long-term goals, right? And so again, this is kind of language that's probably very familiar to many people in the professional world. It's all outlined in the book if it's not familiar to you. So really that's it. But yeah, for testing, for example, so setting up a goal where for us, and this was totally innovative, for us, I'm just going to use that example, the medical action team, we said, well, what's our biggest risk here in this county? And our biggest risk, for those that don't know, San Miguel County in New Mexico, we have the highest percentage of congregate setting residents in the state. And so congregate setting residents, meaning folks, we have a state hospital here, a state behavioral health hospital, we have our local hospital, we have nursing home, a very aged population, 2 nursing homes. We have a lot of boarding homes for folks that were in the state hospital at one time. Maybe their families abandoned them when they got out, and so they ended up staying in the community and they live in boarding homes. And so that became our biggest risk, is congregate settings, and particularly congregate settings with residents that maybe don't always comply, and they still go around town, maybe because of their health conditions, don't have the greatest hygiene, encounter a lot of folks. They just it was a very high risk situation. So we set a goal. As a medical action team of building up capacity to be able to test 15% of our congregate setting residents on a surveillance schedule. And so that started on April 9th, as I said. That was one of our first pilots. And so we accomplished that. We weren't done then. We weren't done at that point. Now we're up to the point we've had a goal of getting to where we've done for our population as a county, to do 10% of the full population be the number of tests performed, and we're right there. By the end of this week, we'll be there at 10%. So we'll be, roughly 3,000 tests in a county of 30,000 residents. And so, again, very successful models, and it's not one agency; it's all of us working together with support from our representatives at the national level, our governor's office, and then down kind of hourglass shape back to communications. And segue into that is that there's efforts that are happening to expand testing capacity at a state level, at a federal level, but we're here at the local level. We're not waiting for gravity to trickle down to us. That's why we're the leaders, because we, with our limited resources down here, put all our energy together and we started fighting gravity up towards them. And the goal is a mutual goal, meet in the middle somewhere. And the reason why we ended up kind of first is because we started that process so early. And then it's like, wow, can every county do that? Because that's going to really save federal and state resources when local agencies are collaborating with us.
Dominic, do you think that the 100% community initiative is, counties range from small, they have a big landmass but small population, or a small landmass with, huge exploding populations. How do you see this initiative working? Do you think it's, I don't know, maybe the word easier isn't the right word, but easier for smaller, my podcast is called Rural Matter, so obviously that's my focus. Is this something that's scalable, for larger communities? What's your thought on that?
Yeah, well, one of our counties is Doñana County. That's the second largest county in the state, and they have a pretty large population. It's urban, but also surrounded by rural. It's the story of New Mexico. And I think the model is the model. I think if you what we've seen is that, again, if you have the right champions who have the right 10 champions, and they mobilize. So essentially, this is 10 coalitions in one coalition, but coordinated in alignment. And again, remember, the reason we chose the county model, and whether you're a big county or a small county, you've got county commissioners. County commissioners make some pretty big decisions, control multi-million-dollar budgets. And then you've got usually one major city within that county, maybe two sometimes, usually one, and that's one city council with a mayor. They have a multi-million-dollar budget, right? So whether the county's big or small, you actually have two bodies. But I would throw in the school board and the elected officials there, because the schools play such an important. Mm-hmm. So I don't think it matters the size. I think that, in this model, you have to build relationships. And Katherine and I have talked a lot about, well, how many people are we talking? Whether this could be, LA County, or this could be, a tiny county. Ultimately, there are probably 100 people in each county in the United States, per county, 100 people that can make a decision to either make this model work or obstruct the model. They can't stop the model. They can try to slow it down, and trust me, we could have lots of stories about why people are fearful or unsure. Some elected leaders don't know where this is going. It sounds so new. We could have a good conversation about pushback to change, but in general, identify the 100 people in your county, build good relationships with them, and most of them, I think these days, in the era of 7 colliding crises, are going to be looking for an evidence-based, data-driven model to get us out of this situation. So that's why I think this model can work anywhere. And Katherine and I have been talking, we've been talking for at least a few years to lots of people nationally. When we were doing our Data Leaders for Child Welfare program, we were working in New York City. So we were getting a little taste of how the model works in one agency. Now that's very different than what we're talking about, but we were able to talk in New York City about bringing in partners and what that looks like. In Connecticut, in Pennsylvania, in Kentucky. So we've had lots of conversations with people in different size geographic areas. Ultimately, I would say this, it's gonna come down to relationships. It's gonna, if you strip it all away, your relationship with your leaders, your relationship with your community. If those are good, this initiative will grow fast. If they're not good, it will still grow, but it will grow slower. Because you can't make relationships grow fast, right? You have to invest in them. These are friendships. So I think that this will do well everywhere.
Yeah, thank you for that. I'm going to open it for questions, but first I just really want to ask you something about the communication aspect. I see in my work, we specialize in communication, and I see in my work that communication is so often kind of the afterthought. Hey, we got a great idea, we're going to do this, and then, oh wait, we got to communicate that. And Matt, you shared with me an article that your local paper did, right? And so that was great for small communities who are still fortunate to still have a local print newspaper. Again, speaking about communities that don't have maybe that broad digital access. So in terms of communication, because I would imagine, there's a lot of documents that have to fly around. There's a lot of information that you need to share with your community so that they understand where to go, the concept, what you're doing, because again, this doesn't die. This doesn't live with you all. You're doing it for your community. So what are some of the communication mechanisms that you've put into place? Where are some of the challenges that you're facing to communicate to all the stakeholders who need to know what it is you're doing?
So for this, I want to ask Sheriff Lopez to answer. So he identified this very early on, again, with his leadership, with his knowledge of how you're going to respond to emergency situations. Also, as an elected official, understanding how important it is to have, hourglass type shape communications. Again, that's why I don't know if you have the org chart you could put up, but that might help as Sheriff Lopez talks about our success, how it's working, so that to our state and national leaders from local level, as well as how we are all communicating together and and being on the same page and ensuring that now the public can all have access to that.
I'm going to attempt to share this with you all just so you can see it real quick. And can you see my screen?
Yes.
Okay.
And so there's actually a different org chart. It's a communications flow chart, which I think Matt is talking about. But really, you know, the 100% community initiative, in my opinion, it's the success of it is definitely heavily weighed on communication flow. And I know in some of the questions you had earlier in terms of our legislators, I think this is a big reason and why they're so interested in this as well. So with the 100% community, we're basically establishing an opportunity to support ourselves in many ways, and through our support and through our service sectors, we're able to identify gaps, identify needs, and in some cases provide services to those who might have a need. I know in early on when we were dealing with some issues, for example, we had some food providers who needed more transportation, and then we had some food providers who needed more food but had adequate transportation. So, you know, we're able to offset that and kind of take care of that issue. And so, you know, that's just one example. I know early on we were also dealing with communication flow all the way up to the top to our governor's office, and there was a frustration there because they're getting you know, calls, they're inundated with calls from several different schools. At that time it was schools, and concerns that they had. And so you know, through the 100% community initiative, we're really able to narrow that down and get that communication flow moving through our school services sector and up through us, and then to our community leaders, and ultimately to the governor's office. And really that's something that we've really focused on here in San Miguel is creating a model where we can have a communication flow which goes through one source and all the way up and all the way back down. And that's kind of where we came up with the idea for our call center, and being able to have that communication flow directly with the public, finding out directly from the public what their needs are, or you know, what their issues are, and being able to put them in direct communication with those services that are needed, which is typically the complaint is that, yeah, we have these services available, but you talk to individuals in the community and they're all, well, how do you get them, or where do you go, or what's the contact information? And we've seen several times where we put together call lists or guides for that kind of information, but it usually goes outdated, and so this is something we're trying to keep as a real document. But we hear those needs from the community, and through discussion through our sectors and our teams, we're able to identify if that's something that we can provide care or provide a solution to. If we can't, then we bring it up to our entire team and see if there's a way that we can provide a solution to that. If we can't, then we bring it up to our elected officials or to our county, to our city services, and see if we can provide a solution to it. And if we can't, then we take one unified voice and we send it up to the governor's office or to our congressional level to try and provide an answer for that, or to try and fill that gap. And so that's really, you know, what I see is so important about 100% community, is that it's creating one voice from the top to the bottom, and it's taking away that fragmented approach that we have, and so that way there's one request from our community as a whole, which can identify and solve problems.
I love that we actually have a program called One Voice for our hospitals, which is that when you experience care, you will hear the same thing from everybody with authenticity, right? So everyone has the correct answer, not what they feel is the best thing to say, but the correct answer. And sometimes that is, I don't have the answer, but I'm going to find out. And I'm hearing you say that as well. I would like to open up the time that we have left if you have questions, you can type it in the chat box. Please feel free to do that now, or you can unmute yourself and ask a question. If you would like, because we've got some really remarkable resources here, and I would hate to have this opportunity go to waste without you asking your own questions to our 100% community panel here. So please feel free to ask. And then while we're waiting for some questions, Dom, I want to just ask you, when I first had an opportunity to speak with you and Katherine, your energy just blows me away, and you have such a beautiful way of kind of illustrating these things as well. And so if you could just talk a little bit about some of, in section 1 of the book, there is a chapter that talks about what percentage of our nation should be able to access survival services. And I mean, I just think that's such an interesting question. What percentage of our nation should be able to access it? So what do you say to that? What percentage should be able to access survival services?
Katherine and I have talked a lot about this for a long time. And I think the question for each of us on this call is really what percentage of our children should be safe? Like, should 20% be safe? Should 40% be safe? I mean, we can start with that question, you know, and ultimately, you know, Katherine and I would ask this question early on when we were talking more about childhood trauma. We would ask it, and of course, everyone says, well, 100% of our children should be safe. Absolutely. Everybody agrees. And then you go, okay, now what do we have to do to make that happen? So I think that it's a provocative question that I think should be asked in every city hall meeting, every county commissioner meeting, every agency meeting, which is what percentage of our county's population should have access to food? I mean, you just start to keep it simple. Just keep it really simple. You know, in a pandemic, what percentage of our population should have access to timely medical care? That's the question as a society we have to ask ourselves, right? Because is it 20%? Is that good enough? We have the capacity for 100%. Other societies do 100%. They resource their societies to make sure that happens. We don't do that yet, but we could. So I think this is very much a soul-searching question. It's a political question, but what percentage of our neighbors should survive?
Yeah, exactly the answer. Oh, everybody. I do have a question. One of them is there plans for there to be an audiobook for the future? Because I think, and the question is that folks like to, you know, I think it's trying to get away from having to read it, but an audiobook, is there going to be an audiobook available?
Well, Katherine and I have had many conversations about this. In the old days, when people used to drive 4 hours in New Mexico to go to a 1-hour meeting, we knew that if we had audiobooks, that would be great. So we have big, bold plans. People should know the Anna H. 8 Institute is essentially 3 people. You know, we have a technology guru and Katherine and myself. And just with 3 of us, in 1 year, we have managed to actually do quite a bit. The plans were always to get the first book up and out and get that in Kindle form. And yes, there are plans now that we have the mini books. We're looking to have each of those turned into audiobooks. And we actually want to do a cartoon book. We're working on a book for families called My Family at 100%. We're working on a book for college students and high school students called My Life at 100%. And all of these should have an audio component as well as animated cartoons. I mean, we think people will learn in different ways. And, you know, just give us another year and we're going to have the whole thing lined up. We'll basically be, you know, the Walt Disney World of surviving and thriving.
Somehow I believe that. I have another question, and that is, what role do faith-based organizations have at the table?
So I can answer that, I think. So, you know, it's really at every table. a huge role. And so at every table, because faith-based organizations across the board, faith-based organizations are involved in food. Faith-based organizations know people that need food. And that's just one example. And so absolutely, it's a critical component, especially in rural communities. You know, right now we're working on a huge project. I said earlier that we've taken on 3 projects now. Our 3rd project we're taking on that is 100% of all action teams addressing one issue, and that is the census. And to be able to get the census, which is huge, right? Because that goes back to resources and having adequate resources as a rural county. And so how do we get the census out? You know, again, anything that you put out there, I don't care if it's schools, I don't care if it's census, you know, you have to include faith-based organizations. So it absolutely is a part of it, and that's actually also written in the book.
Of course it is. Yeah, of course it is. And so the other question I have, just in terms of, you know, the transportation, I actually interviewed, there's an organization called Phoenix Mobility Rising. I don't know if any of you all have heard about that. Matt, have you heard of Phoenix Mobility Rising? So they're focused on rural transportation. Obviously, Uber doesn't exist. And, you know, and of course, during this time of COVID, you know, that would have been an issue regardless. We see that in some of the bigger cities. So where you see there is a gap in the community, in the county, so if there is not a transportation agency, for example, or one of the other action teams, how do you go about filling that gap? Do you have some insight into that for us?
Well, I can just say that, yeah, so transportation's meeting this week. There are major gaps. This is a huge landmass county with not that many people here. They have identified those gaps. And then the book helps, again. So in the book is, so, you know, also like lists of all these different initiatives that any county can now say, oh, we've identified this gap. I wonder what type of thing exists. Do we have to like totally invent something new? Well, no, it's about relationships. It's about connecting dots. It's about weaving, right? That's what it is. And so the book also helps to do that, to connect to different agencies. But I think this is the power, even just you saying that, Michelle, is that it's not just about what exists in New Mexico, what exists in the rest of the country. What, you know, I say back to the roots, you know, we're one big aspen grove across rural America, across the rural world, if you will. Our roots are all connected. And so we think we're like so far apart, but the solutions are all intertwined. And so learning from each other, and I think, you know, you see a lot of that coming out of action teams. It's like just what Michelle just said, you know, oh, I heard of this thing that's happening on, you know, rooftops in Detroit to grow, you know, market vegetables, and you know, whatever the thing is, and then you research that. Next thing you know, you're connected to inner city Detroit and some initiative for food. You know, it's that type of thing, and that is the power of 100% community. So
really, this is a kind of a course in innovation too. Would that be a fair assessment, that if you don't have it, it doesn't mean that it doesn't exist. It means you have to be innovative and go out and find it. What are some of the other... in rural America, if you didn't have it, if it wasn't readily available to you, if you just gave up, you would have nothing, right? I mean, innovation is how we survive. It's just ingrained natural to us. It's part of our culture. Yeah, so this really just kind of takes it to the next level. So, and looking at part 4, the workbook for action, I love it because you do have the first chapter, chapter 40, first we survive, then we can thrive. And right now, I think it's fair to say that there's a lot of folks out there really just in survival mode. And we're kind of searching and searching and searching for when we're going to be able to start to turn the corner and thrive. And then from there, you go into food 100%, housing 100%, medical and dental 100%. It feels so awesome, you know, when you look at it on paper and say, yes, this would be the vision for what we can have. And Matt, we kind of started with you with the vision. In your assessment and the work you've done so far, what is the timetable? Because I know timetables are important to you as well. We kind of get frustrated if things aren't happening, and we are a very instant gratification kind of society right now. So what can folks who are with us expect in terms of how long? Granted, your situation was different because you were ready to respond, but to get their 100% community initiative from concept start, reading the book, to the point where they feel like they've really got some meat and some progress. What can people expect in in a time other than a pandemic, when everyone's stretched really far.
Yeah, there's a timeline in the book, and so we looked at that in book club. Again, you'll find that in there, and so here's the gives you stepwise, walks you through it. Again, it's a framework. It's beautiful because you're not having to scramble. Again, when it was like at the World College, as Kat mentioned, it wasn't like, so are you ready to do this? Like, no, we're doing this. We're doing this. The difference is that now we have a framework to do it without scrambling around. Now we have just something to follow. So yeah, absolutely, we were already going to do this, and now we're going to weave with you all to do it together. With that, I think that we looked at that timeline and we said, pre-COVID, we said probably more 10 years. That's what we said as we sat around the table for book club, and then we went from there. We're like, nah, just a lifetime. And it wasn't shocking at all, because everybody that was at these tables has committed their lives. Everybody on this call is my guess that you've committed your lives to this cause already. And so it was just natural to be like, yeah, a lifetime. That's cool. We got this. And so, but yeah, within that, there's many initiatives. You just heard about a few that we've done very rapidly, some within an hour. It's about connecting dots and saying, actually, no, we do have that resource. Or with a little bit of elbow grease, we can get that done now together.
Yeah. This call, we did it in less than 2 weeks. We got it all together. So I mean, hungry people, they go out and hunt. But I guess I asked this because I know people who are in public health. My whole career is working with people in public health and rural health and rural education and all of that, and we're all hungry. And then you talk about the fact, one of the things in one of the chapters, and if I don't have it correct, was about the fact that you have to go from, what was your, looking for that, courageous champions versus keepers of the status quo. And I'm curious how you sort, I know it's in the book, but if you could just give us a teaser, how do you sift out those courageous champions from those who, how do you know if a person within an organization might not be the right fit for the team? Have you experienced any of that?
So I will just say for what we did for San Miguel County, that's why the very first call, when it was like, now we need to take this to the next level, with Sheriff Lopez, because I don't care if it was on a wrestling mat, it was on a football field, it was amidst a battle, it's amidst a pandemic. There's no one else that I would rather stand back to back with and throw down than Sheriff Lopez, not just because he's really tough, because that's how he's wired. He's not going to quit. There's no quit in the man. And there's something else about that too. And again, back to everybody on this call that's giving all this time, it's that this isn't about what I'm going to get. This is not what I'm going to get out of that. If that's what you're looking for, 100% community is not for you. And that's been the interesting challenge, is that you have these agencies and they see like this is a competition and I need to get, rise to the top of the totem pole or whatever these things are. And this just does not fit. And, this is about everyone working together for everyone. It's about living to serve, which is my motto. And it's living to serve. It's not what you're going to get, it's what you're going to give. And for those people that are just wired to give and have no quit in them, 100% community is for you.
Dom, anything to add to that? Katherine, add to that? What would be your definition of a courageous champion, other than who we're listening to, Kimberly and Sheriff? How do you sort those out?
I think they naturally sort themselves out. That's been our experience. They kind of rise to the top and are persistent and are constantly, checking in with us, checking with their communities, moving forward. And the resistors also naturally kind of show themselves and also kind of naturally back away and stop being involved and go on and do their own thing. And I think Matt is just exactly the perfect definition of a hero, of a champion. He's doing it. He's not waiting. He's not waiting for anybody to tell him, yeah, you have permission to do this or you to do this. It's just happening. And that's been true in our other counties as well. It's these people who are in it. They're seeing, the struggles of their communities firsthand. They're working in it every day. And they're saying, we need different. Here's the vision. We're going to do it. We're going to move our communities forward. We're not waiting for someone to tell us to do it.
Yeah, that's got to be the motivation. So I can't believe that we're coming to the end here. And before we leave, I want to hear from all of our panelists, just kind of your closing sentiment about the impact that you hope to make. And one of the questions I asked everyone to be thinking about as they came into this call for our participants who are here, what is your impact? And I named my company Impact many years ago, not even being able to foresee 31 years ago that this would be my work, that I live to serve. What impact do I want to make, which is to bring people together and understand how to communicate more effectively? Sheriff Lopez, what is the impact that you hope to make by being involved with this? Now that you're in it for life, what is the impact you hope to make?
So in my career, emergency services, law enforcement, I took on that role to take care of my community, take care of the people, and that's always been my goal. So anytime that I become a part of something, that's what is in the back of my mind, is how can I better serve my community? So through this 100% community initiative, it's really given me the tools and the opportunity to do a lot more with very little than what we were doing before. And so as we continue to move this forward, and in terms of the pandemic, to me, we pretty much put together a state leading model in response and resources, which we pretty much are self-provided for the most part. So when all of this is over, I'm hoping that we can continue that effort and continue a state leading response to resources to our underserved and to those that are in need in our community. And I'm very proud to be a part of it. And to touch on the question you asked prior, if you're not moving, it'll show, because you're around a lot of movers. We have a lot of community movers involved in this, and when we were picking individuals to help with this, that's something that we really looked at is through our work in San Miguel County. You get to know and get to see the people that make things happen. They create action, and that's something I think that is vital in setting something like this up. You want your movers involved because people have faith in them, people trust them, and ultimately they're going to get the job done.
Yeah, I appreciate that. We talk a lot about the word accountability, and one of the first things I ask an audience is, when I say the word accountability, what do you think of, punitive or positive? And depending on if you're a quality manager, you say positive, and a lot of times frontline might say it's punitive. And so what I love about what you've established is that there is an accountability, and that's such a positive thing. You're accountable to your team members, to your collaborators. Kimberly, what impact do you hope that your participation, not just for your employer, but for you personally, what's the impact you hope to make?
So thanks, Michelle. I think for me, as I mentioned, this is my home community. This is where I'm from. First and foremost, and I've said this all along, I am involved in the community on a personal level because it means so much to me. This is my home. This is my children's home. And so I want to continue to be involved and make a difference for future generations. I also recognize that education is a big component in how social mobility happens. And so for me, being able to and have the opportunity to continue to do that is extremely important. And so similar to Sheriff Lopez and to Matt and Dom and Catherine, I think that there's tremendous possibilities. There definitely is the opportunity to continue to be in service to the community when we're over the pandemic. Then what will happen? Can you all hear me?
Oh, yes.
Okay, everybody was frozen. I was like,
we hear you. We hear you.
Well, I never know technology in rural areas. So in being in service as we're done with this, we're on the other side of this pandemic. We anticipate there's going to be something else, and we're going to tackle it. I think something that's important to know, when we had a book club and we're talking about adverse childhood experiences and trauma, this is a lifetime. It's important for us to also, be authentic and open and honest about the realities of what we're facing, what our limitations are, but also, and this is something that Matt's really big on, is training our youth to then come and take our place and continue forward with what we're doing in our communities. It's something that I'm very fortunate that I've had the honor and privilege of being able to do within my community, and I hope to continue to be able to do that and just have a positive impact for future generations to come.
I'm sure glad you said that, because we take a look at, Matt, this is very familiar to you, health profession shortages. We have teacher shortages in rural communities, and we talk about the need to, quote, grow our own. And I think what you're providing them is such an amazing, we've left kind of a mess. And so what you're providing them is such an important lessons and framework for their lifetime. Matt, I'm going to do you last, but for Dom and Katherine, what impact, I mean, clearly Anna age 8, this 100% community, what you've created, in my view, it can change the world. And that's my humble opinion here. What impact do you hope to make, regardless of how you started? Now you're seeing how it grows. Dom, what impact do you hope to make through all of your efforts?
Yeah, I'll just go back to my favorite percentage, 100%. I think if that's the percentage in all of our heads, if we can contribute so that people understand it's just everyone, everywhere. So in our community, we set our sights, and if our model can grow that sense of caring, then for me, that's a huge sense of accomplishment. And as Matt said, I think people already have these ideas. I don't think what we are pitching is new at all.
Right.
I think the framework is new. And I think I think Katherine and I have worked very hard to create a framework that anybody on this call or in this nation could take and run with.
Excellent. Katherine?
Yeah, ditto, 100%. But I'm a native New Mexican. I grew up here. I have deep, deep roots here in rural communities here. And I want to see the kids who are growing up in those communities have the same opportunities as kids from anywhere, because I know that inherently they also can thrive and be just as successful as anyone else. We just have not had the access to the resources in the state that we need. And there's a way to make it happen. And I think, people like Matt and people like Sheriff Lopez and Dr. Blea, all of us who are native New Mexicans who have worked our butts off to get access to the resources and have been lucky enough to have support to do that, show that it is possible that kids here can thrive and survive. And any kids from any rural areas, anywhere in the nation, it's not a sentence. It shouldn't be a sentence just because you're born in a certain zip code. You should be able to have access and be able to thrive just as much as anyone else. And that's really my goal, is to show that in New Mexico. And like Matt said, the next generation of youth are going to, thrive and really blow us all away and probably put us out of jobs, which is great.
That would be a good thing. That would be a good thing. Thank you, Matt. What is the impact that you hope to make?
Just a little story to end. I know we're over time a little, but so for those of you that didn't see the film, so Ignacio Lucero, one of my mentors from this community, one of my patients, but really I don't know who was the patient near him. I learned so much from the man, and he changed my life. So on his deathbed at age 92, and working every single day of his life up until then, and with a huge smile on his face, and doing amazing things. I asked him, and I'm speaking about a man who fought in World War II, witnessed the aftermath of Hiroshima and Nagasaki, came home from the war and told his community and his family, don't you ever complain about anything, and just lived such a beautiful life, and had such a light to him. And I said, what is that? What is that? We're all looking for that light. where does that come from? We're all looking for it. You have it. I want to find it. And so he reached into his hospital gown and he pulled out his St. Joseph medal and he said, the key is live to serve. Live to serve. If you just do that every day, you don't need to know what to do, Matt. You don't need to be any kind of shepherd. You just need to be a sheepdog. You just need to do what you're told and do it every day, and you'll do it, and you'll just be happy every day, and you'll get up with energy the next day to do it again, and you'll do it every day for the rest of your life. And that's what life's all about. Live to serve. And I think about this time that we're in right now and all the hardship, but I think about my kids and all the kids we've been talking about, my passion of youth medicine and what they're facing. And I still see hope. I see hope that they're going to get through this, that with mentorship, like he mentored me, I hope to mentor them and say, yeah, you're going to go through some hard times. We're all going through a really hard time as a society right now. It's changing, our comfort levels. But with that, there's so much to be done, and how are we going to do this together? And so, that's my hope. That's what I see. I see this future when I'm at the end, as Ignacio was, and we all will get to, that we'll have helped grown, another greatest generation that will get us through this time, and we'll move forward just healthier and better as a whole country and as a whole society. So I know it's a big vision, but it's achievable. I know it is. I know that COVID is setting us back, but is it? Or is it really a wake-up call? How will we respond? This is a historic time, and I think for all of us on this call, our kids or our grandkids or whoever it is, some next generation is going to say, what were you doing? What were you doing during that COVID thing, and that I read about in the history books? What was going on? And that's the question for all of us. Were we sitting on our hands waiting for someone to come rescue us, or were we mobilizing and together taking care of everyone? That's the response I'm looking for.
And that's what you're doing. This group gives me, so much energy, as if I didn't have it as it were before. I want to say this before we close. People keep talking about, we want to go back to normal. We need to find a new normal. And I'm challenging everyone on this call. Normal is lazy. We've got to really look at this group of people and say, this is not a group of lazy people, and they're not going back to normal, because normal in your community was leaving people behind. And going back to normal means continually leaving people behind who have all been further pushed down because of the disparities that this pandemic is causing. So I'm going to challenge everyone on this call to please reach out, read the book. I'm going to cook up something. Dom and Katherine and I don't care how we do it, we're going to take this show on the road, because I think it's such an important message. You've just got yourself up, whether you want to or not, a communications person, because I'm in your life now. So thank you so much. Thank you so much to all of you. It's been just such a privilege. I'm so sorry for those initial hiccups with the technology, but as I said, we're recording this. We'll get it up on that doitwithimpact.live site. Please read the book. I'm seeing some notes here from people. They're feeling very motivated. And I just want to thank you all for taking the time. Dom and Katherine, you didn't know me, but Matt did. Sheriff Lopez, you've been getting a lot of emails from me, and that you trusted him is the reason why you trusted me, and this is how this works, right? So I wish you all the very best, continued health. Thank you for all your service, and I hope to have this conversation with you next year, and we'll see how you did. And I think that would be really interesting for all of us to hear back from you, to see where you're at. It'll be very exciting to watch. Thank you, everybody. Take good care.